My name is Bharti. I'm a board-certified plastic surgeon at the Hunstead-Cortez's Plastic Surgery Center. Today I wanted to talk to you about male non-surgical aesthetic rejuvenation. Men are more and more seeking aesthetic interventions to help improve their overall look, their level of confidence, and their overall physical appearance. And there are a lot of options that are available now that we did not have in the past. Most simply, some of the options are the initial things that people are searching for are things such as facial rejuvenation to not look as tired or to get rid of unwanted wrinkles. And so things like Botox as well as fillers have really come into play in the male marketplace. And my patients are range in age from anywhere from late 20s up into 60s, 70s, and 80s. And starting patients with these, when they ask me, what should I start with, it's really dictated by each case. What I mean to say by that is that I try to get into the patient's kind of overall goals and expectations about what they're hoping to achieve. Some patients want to be much more aggressive, whereas others want to be very, very minimal and just see if they can have a subtle improvement. For example, maybe not having as many wrinkles on their forehead or in between their eyes or in their crow's feet area, which Botox or Dysport can treat very well. In certain situations, men as well as female, as we progress through the years of life, we will deflate. And what that means is that our facial volume will decrease. And that can be very easily combated with fillers. Things like Juvederm, Voluma, Restylane. There are countless other ones on the market. But those are things that we can use off the shelf, minimal downtime, a little bit of topical numbing medicine, and actually add volume to different places, such as the cheek, such as the temporal hollows. For men, another area that can be used is lips, although more common in females. Also in these folds around your mouth called nasolabial folds. A lot of men want to have more of a stronger jaw or a chin, and we can use fillers for that also. And later on, at some point, if they want to use something more aggressive like actual implants to give them more formal augmentation that would be long-term. So those are some of the things that we're using for the face, but in addition to that, we have different tools now, such as things that will actually lead to skin tightening. We have a device called ThermiTight, which is a non-invasive radio frequency device that will help tighten neck skin. We also have another device called Profound, which actually uses radio frequency technology and combines it with microneedling. So you can get, when someone comes in with the early signs of facial aging and skin descent, you can actually bridge them and not have to necessarily do a facelift, but use this other devices like Profound and a CO2 laser resurfacing to achieve a youthful look, and maybe several years down the road then consider something like a facelift. So it's very interesting that we're able to take care of these patients who are not ready for a surgical procedure, but use some non-surgical options to really make them happy and give them the confidence that they desire. Other things that we can do for men are body contouring non-surgical modalities. We're able to use things like cool sculpting, which uses cold technology to essentially freeze unwanted fat that leads to the fat dying and gets resorbed into your body. Those procedures are nice. It's not necessarily a surgical result, but it's no surgery at all, no incisions. Often people have to have a couple treatments, and it's used for specific areas like love handles, which there's unwanted fat that needs to be treated. Therapies. Another option is something called Kybella, which is a injectable fat-dissolving solution that we can use specifically for the neck. So there are a lot of options for men that are out there, and then once they are ready, they can consider more surgical options. Places where men consider having surgery are places like their chest, for things like gynecomastia, to remove unwanted breast tissue. We do things such as liposuction of the entire abdomen and lower back and hip rolls. In addition, we do facial procedures such as lower lid blepharoplasties, upper lid blepharoplasties, facelifts, brow lifts. And the goal for all of these is to figure out where our patient is in the continuum of what they're trying to achieve, what kind of result that they want, what kind of downtime that they want. But most importantly, with all these patients, we want to avoid them looking operated on or looking synthetic or artificial. I hope this helps. Thank you.